Tardif. I'm the station manager and news director for WGCU Public Radio. And we're talking about Healthy Lee in our breakout session here. Healthy Lee is a community culture of healthier lifestyles. And first I'm going to introduce our distinguished panel. On the right with Robbie Webstor. She's the president, director, and co-founder of Edison National Bank, Bank of the Islands in Fort Myers, Sanibel, and Captiva. She and her husband Jeffrey founded the bank in 1997. Robbie is its principal representative and spokesperson and is a member of the bank's board of directors and its holding company. She serves as immediate past chair and member of the board of trustees for Florida Gulf Coast University. Immediate past chair, director, and executive committee member of the Foundation for Lee County Public Schools. Chair of the Healthy Lee Steering and Executive Committees. Trustee and executive committee member of the Southwest Florida Community Foundation. A business representative for the Sanibel School Advisory Council. Past chair of the Horizon Council, and she serves on the board of the Industrial Development Authority and Airport Special Management Committee, and has won awards too numerous to mention. Welcome, Robbie. In the middle is Sally Jackson. She's the System Director of Government and Community Relations and has been part of the leadership team at Lee Memorial Health Systems since October of 2005. In 2007, Sally helped launch the Community Health Visioning 2017 project, now known as Healthy Lee, to improve health in Lee County over the next 10 years. She supports the Healthy Lee Steering Committee of 60 community leaders. Many of the projects have received national and local awards. Sally's earlier career in Illinois and Ohio included leadership roles in state government, chambers of commerce, higher education, and publicly traded corporations. Welcome, Sally. And Annette Pounders has been the practice administrator for Physicians Primary Care for 10 years. PPC is the largest independent physician-owned multi-specialty primary care office in Lee County. She has more than 20 years experience in medical group practice management. Annette's a fellow in the American College of Medical Practice Executives, and she is active in the local healthcare executive forum, the Healthy Lee Steering and Executive Committees, the Children's Mental Health Task Force Committee, and the National Medical Group Management Association. Welcome to Annette. To begin with, each of you ladies are going to have about 3 minutes to give us opening comments on your area of expertise dealing with Healthy Lee. So let's begin with Robbie.
Okay, thank you so much, Amy, and good morning, everyone. Healthy Lee was originally made up of 38 community leaders. We convened back in 2007, and at that time, it was known as Community Health Visioning 2017 in order to come together to do a vision. This 38 leaders was actually created and recruited by Jim Nathan and his Lee Memorial Health staff through discussions with them as to who would make an impact, who were the leaders that would come together and really devote and commit themselves to this. But we were charged as a steering committee, these 38, to actually collect data, engage the community to create a baseline on community health. So we brought together like 4,000 Lee County residents, not all in one room, trust me, but we went out to 4,000 Lee County residents in that process through telephone, household surveys, focus groups, town hall meetings, internet surveys, and an analysis of published data. That's what we all did in the beginning. So together, the steering committee members agreed that we were going to focus the entire community's attention on priorities that could improve community health and or the healthcare delivery system over these next 10 years, because we knew nothing changes overnight. The needle doesn't move immediately, regardless of your best passion and your best interest. So we thought, let's do this vision and let's make some changes and impact over 10 years. Well, we're now entering that 10th year, if you can believe it. I mean, it flew by. So we have conducted over these 10 years actually 3 community health needs assessments, because we want to measure ourselves as we go. Are we getting there? Are we not getting there? What do we need to do? We developed a scorecard to measure these results, and we recruited champions for all 7 of our goals, which you'll hear about later. Those goals, we focused on those, so we brought best practice models to Lee County. We developed new models for our own successes, many of which have received national recognition, which we're very, very proud of. Our steering committee meets annually, and now that steering committee is up to 60 community leaders. We're very, very proud that people wanted to get engaged, how they get engaged, but the key was to keep leadership that had their thumb on the pulse of things. The key to Healthy Lead has been that leadership role of the community, and we believe that with engaged leadership and a shared vision of collaborating for community health, we could improve health, and we have done just that. Everyone at the table of the group has been asked to follow the principles of Healthy Lead, and our principles we nailed down is you got to have things that sink them, because you got to choose, you got to commit, and then you'll have change. And so those 3 C's have really made a difference. Every time we think about something, we're going to choose to do this, we're going to commit to do it, and we're going to see some change. So in using our own individual spheres of influence on individuals, their own families, neighbors, friends, business, or other organizations, that's how we got so many engaged in all this. Because Healthy Lead, we don't want to take anything ever away from it, although Sally, my face is attached with it so much. It is a community collaborative. Nothing could be done unless it's owned by the community and there's collaboration. And that is what we're most proud of even all the awards, but having that at the forefront is what produced the recognition. Well, while the leadership role has been focused attention on priorities and measuring results, the hundreds of community partners who are now involved have found their own ways to pursue their own contributions to community health, because it brought this big vision to all the different collaborative partners in the community. We then determined that we had to form an executive committee, so we do have an executive committee that meets bi-monthly, and it provides support and guidance to the number of initiatives and the champions that represent these 7 priorities. So in this way, we've managed through many transitions in community leadership and organizational changes, including that deep, dark recession that we went through that hit us around here. And so we have to make adjustments. So that's where the executive committee really did play a role. We wanted to achieve a strong business role in support of Healthy Lead. It's not just about consumers, you've got to have businesses engaged. And specifically the opportunities for workplace wellness initiatives and health insurance practices targeted to improve and reward healthy habits and improve health. So what we did, focusing on that, and in order to pull in businesses and government leaders, we engaged the Horizon Council. I could tell you so much about that, but Amy's limited me to 3 minutes here, so I have to keep going. So our Horizon Council has been a member for about our 10-year period, and that's really what's engaged the business community. And when you engage them, it trickles down, you're engaging families. So we formed the Horizon Council. Let's see, I don't want to talk much about that right now. I'll get to that later. The Horizon Council is what really turned around and did a lot of initiatives with us. I won't get into the weeds on it, Amy, I promise. But it gave some great results, and we still have a lot of leaders talking about their personal experience, and they filtered down into businesses how to put best practices in place. So bottom line, at the end of the day, by engaging the many collaborative partners, we're really truly building, in our mind, a culture of health for Lee County, Florida. Thank you. Sally.
So Riley described the way that we collected the data as we started this process, and that gave us a very good baseline, but it gave us literally hundreds of data points. So we had the steering committee work in facilitated discussions to turn that into what they saw from their own personal experience and interaction in the community, weighing that against the data. They turned that into the 7 priorities that we have followed from the very beginning. And for the first 4 years, our number 1 priority was behavioral health. That was the greatest need that was identified in the community, and it continues to be a need. But after 4 years, we saw that through leadership and visibility and positive interaction with the community, we had brought in new investment in the community. We had brought new investment to existing organizations in the community, and we had seen an expansion of 322 new beds for behavioral health in Lee County, Florida in 4 years. Unbelievable. So the steering committee said, let's just let those new investments take time to gel. Let's let them get organized, let's let them get populated, let's see how they collaborate, because collaboration is key. Our vision is collaborating for community health. It's not competing, it's not in any way overshadowing anyone else. It's filling the gaps through collaboration, raising the bar through collaboration. So when we met after that first 4 years and saw that things had improved immensely in terms of filling the gaps for behavioral health, our steering committee reprioritized based on the data and put healthy lifestyles first and foremost in their vision for the community. So for the last, now in the 6th year, we have been prioritizing all the elements of healthy lifestyles as our top priority. As individuals, as families, as organizations, as businesses, as neighborhoods, we've taken that vision into the community through our collaborative partners. And in that way, we've been able to focus on public policy, food and nutrition, physical activity. And we changed our scorecard to put the overriding #1 variable of community health that we want to monitor and change to be obesity. Because obesity is a precursor to other chronic diseases. It is a pattern that can be reversed. It is an opportunity for prevention through education. And we know, because of the research and because of the ongoing work of the steering committee, 80% of many chronic diseases, such as heart disease, stroke, and cancer, 80% are preventable with proper healthy behaviors, good environment, safe streets, all of those elements that are important for a healthy community. And we've moved the needle. So I would refer you to the back of your brochure and just highlight a couple of points. Over the period of 2007 through 14, when we did our last survey of the community, we only do it every 3 years, we found we had seen a 15% reduction in obese adults in Lee County and a 34.5% reduction in childhood obesity. Those are significant, they are statistically significant. We are in the right trend, and we are continuing to drill down and pursue even better profile for our community. We also looked at the physical activity in the community, and we saw that 25% fewer residents were showing no leisure time activity whatsoever. So those who were on the lowest end of the spectrum improved by 25%. When we look at those who are actually meeting physical activity recommendations, national standards, 22.5 more residents were meeting the standards. So we improved on the high end of the spectrum as well. So we are touching people wherever they are in their lives, and that's the goal of Healthy Lee. We want to reach the whole community. But most significantly, down at the bottom right-hand corner of the back of your brochure is our most important message. Lee County, Florida has seen a 29% reduction in deaths from heart disease and stroke. Healthy lifestyles, good collaboration with our community partners in the medical community and EMS, everybody focused on improving the health of our community through Healthy Lee.
And Annette?
Good morning. Coming from the medical practice side of the team here, we became engaged in Healthy Lee many years ago, and because we felt like a lot of the initiatives that Healthy Lee was promoting fall right in line with primary care. And particularly with our practice is we have OBGYN, pediatrics, and family and general medicine. So our mantra, for lack of a better word,
Robbie, you talked about the Horizon Council. Let's go into a little bit about how businesses can support Healthy Lead. What are some of the activities or things that they do that allows people to get up and walk during lunch hour, all kinds of things?
Well, and I missed a point that I wanted to make a point of. I tell everybody in 2007 it started out as Community Health Visioning. Okay, then why are you called Healthy Lead? Well, in the first couple of years, about midway through, when we sat down and readjusted our priorities, we saw that we had the vision. But it was only until we went to the Horizon Council to engage them in Healthy Lead. And how do you engage somebody? Well, you've got to put them right out there in it, especially business people that are so busy. So we went to them and we started the challenge. And we branded that challenge, and you couldn't ask them to put skin in the game. I said, no, we're going to pay for it. And then they can't say no. And Lee Memorial supplemented half of the cost, and the Horizon Council Foundation supplemented the other half. And so we said, you have no excuse. You don't have to lay a dime out, and you're here representing your constituents on the Horizon Council, because it is a private government type thing. So we went out, did this challenge, and we branded it Healthy Me, Healthy Lee. If I get healthy, Lee County's going to get healthier. So they did that challenge, and like I said, it made a major impact. So much so, that is how different practices, best practices, funnel down into smaller business, because smaller businesses are backbone. You find the larger businesses in town will have their own health centers and gyms and programs, but it's the small business that doesn't have that, and you say, I can't afford that, I can't afford that. Well, we gave ways. And one of the other things that we did was create a website, which you'll see in the brochure. And each business would go out there and put their best practices so other businesses could pick up on what they're doing. Well, the Horizon Council saw the value of this, and they went ahead and they formed a healthcare task force. So it's still living, breathing. And that's where we had some summits, and businesses come to it. You have different speakers, and you learn a lot from those speakers. And the insurance companies, back when we started, they didn't really have programs and plans for the 1 to 2 employee type small businesses. At the last summit, each insurance representative, major company was there, and they rolled out these plans, these incentive things. So it is trickling down, it is making a difference. But that Healthy Me, Healthy Lee stuck and branded, so that's when we changed the name to Healthy Lee, because we had the vision and we needed something that everybody could identify with and something that everybody could be a part of. So that's how Horizon Council played a great role.
I know FGCU just this semester started walking Wednesdays, so it's trickling down. Something that Annette and Sally said struck me. You can go to the pediatrician's office and the pediatrician will ask you or your child if they're old enough. Are you watching a lot of television? Are you on the computer a lot? How much juice are you drinking, and these kinds of things. But how did we get those obesity statistics down when the focus was really on children? What kinds of things were being used to attack obesity in those last 10 years that we had such success?
Well, Annette talked about the conversation that our pediatricians and family practice physicians are having with the family and well-child visits, and that is important. People listen to their doctor, don't you? Beyond that, the schools were a major partner, and the brochures, the posters are being used for education in the classroom by teachers, by volunteers from the Department of Health, by our child advocates from Lee Memorial, who go out into the community and share the various message of health and safety. So by reinforcing that message in all of those venues and using the fun graphics repeatedly, kids recognize this now, and they can tell you what it means. Families are having this conversation, and so it's been reinforced again and again. Now we're starting to add the daycares. We're rolling it back a little bit. That's another opportunity to try to get into the daycares with the visual, with the message, with the change in practices. Hey, the schools, the very first year we started all of this, the superintendent said, we're pulling the fryers out of all of our schools, and they did. There's no fryers in the schools anymore, no fried food. So, that was 10 years ago, folks. 10 years ago, okay? And then the schools applied for the American Heart Association's Fit Friendly Employer, showing what they were doing in the workplace. The schools were the very first employer to be recognized as gold, and the next year they were the first employer in Lee County to be recognized as platinum level. So they got on board, they're delivering this message, they're working with their employees, with the kids and their families. They've changed so much of the nutrition. Instead of having cookies and salty snacks for breaks, they switched to fruits and vegetables. So if you're in the grade schools and you see their snacks, they have these little packets of sliced cucumbers. I never saw a sliced cucumber during my grade school days, did you? Okay, so that's what we're talking about when we say a culture of health. Everybody gets on board. You reinforce the same message. You change your behaviors, which allows people to change their habits. Choose, commit, change.
Well, let's turn to mental health. We still have an enormous gap in services, especially for children, but also for adults in Lee County. Annette, you're a member of something called the Children's Behavioral Health Task Force of Healthy Lee, and I believe that you just finished some sort of conference. So can you tell us about that and how it might help close that gap?
One of the initiatives is it relates to is behavioral health in the area, and particularly a focus we looked at was children's mental health, because there is an access issue, there's a resource issue, a financial issue in dealing with children's mental health. Under Healthy League, a task force was put together called Children's Mental Health, and they brought in people who have say the ability, but the talent to make things happen with very little money to no money. So there was a lot of brainstorming that happened, and a lot of planning. Salisbury was able to obtain a grant from the Reach Institute, no, from the state to bring the Reach Institute in this past weekend. About 26 pediatricians and a family practice practitioner was trained, additional training on evidence-based medicine on how they can help contribute to dealing with children's mental health issues. Typically, a pediatrician takes it so far and they refer to a psychologist or a psychiatrist. Well, we're limited with child psychologists and psychiatrists in the area, and the ones that will take Medicaid, the ones that will take children with no insurance, and a lot of pediatric practices struggle on how to take care of these children. This training that they went to would have now given them more ability to handle those within the practice and be able to provide the much needed care that the parents needed for the children. You know, some of the feedback that we had from the pediatricians was, wow, this was amazing. You know, I think one of them had told me they felt we were short about 30 psychologists, psychiatrists in the area, and now they're able to fill some of that gap to a certain level with more confidence. They will continue networking and training with the Reach Institute as this pilot program goes on. But I think we're going to really see a difference within the county, within the pediatric practices.
And if I might add, that is that collaborative effort again, because we pulled in the Community Foundation of Southwest Florida to moderate and to be the facilitator. And when Annette says we pulled in people, we pulled in the Dean of Health and Professions at FGCU, we pulled in from someone from the school, we pulled in a psychiatrist, we pulled in Annette, we pulled in different people and said, what are our resources? How are we going to do this? So that's when Sailors Care came up with, I'm going to go for this grant because of the need. And I think in the beginning, the pediatricians were a little like, what? A little skeptical. And so now they just walked out of there, all of them signing up because it truly is a pilot. And documentation is key because then we want to show success, go back and say, we need a larger grant. This is making a difference, we need to do it. And obviously, results-based evidence is what can get you the grants. And we pulled in some psychiatrists that are volunteering because have a consult with a psychiatrist that volunteered to do this, to get some guidance if they need it, and or if they need treatment, then they've got an avenue to get in. So really, it's awesome.
So this is a great example of how the leadership sees the void. They pick people who are caring leaders in the community. They may not all have the specific expertise, but they have the desire to come up with solutions to fill the gaps. And it's the first chapter. This task force is going to continue to look at ways to expand what we've learned and go beyond the physician practices. We're looking at things that can be brought to the schools. We're looking at ways to do even broader partnerships with the universities, with all of our wonderful student interns, and see if we can get a permanent feeding structure to supplement this pilot in the physicians' offices. So it's growing, it's a foundation, and we feel really good that it's an important first step to help provide the access that we need so desperately in this community.
With zero money.
Right, that's key. We had a different panelist other than Annette, and she kindly stepped in, and that panelist in our planning meeting said that was one of the things that shocked her, was that it is not taxpayer funded. So I want to leave a little room for questions at the end. We have about 5 or more minutes of questions before we do turn to your questions. But that, I think, might be one of the examples I'm going to ask about next is where does Healthy Lead get its best practices, and are we a standout across the nation for others to turn to?
Yes and yes. First of all, we get our best practices by researching what others have done nationally, like the REACH Institute that Annette mentioned. This was a New York-based research institute that supported behavioral health issues in communities in the best funded state in the country. So they've done extraordinary things. They have all the resources through government funds, including federal funds, that we do not even have access to in Florida. So, I mean, that's our reality. Can we take from those who have the resources to invest in the research and develop the best practices, which they're willing to share? So we look there first. We have many examples of that. For chronic disease management, we invested in Stanford University's It's All About You, a chronic disease self-help program. It's available free to anyone in the community, and we keep all the data on it and report back to Stanford University, so we're part of continuing the evaluation of that program. But it really does change the way people with a chronic disease, whether it's asthma, obesity, diabetes, any other chronic condition, learns about their health and how what they do contributes to their disease or helps to reverse it. So choose, commit, change. Again, another example of a best practice. But where we don't find it, and we have so many unique needs, Florida is among the most uninsured states. Southwest Florida is the second most uninsured region in the state. That's hard to overcome when you're talking about the health of populations. So we have to work extra hard to find ways to fill those gaps. Where we couldn't find a way to fill them, we have developed new initiatives to do so. Bob Johns is with us today. Lee Community Healthcare was created when there wasn't enough access to clinical care in primary care for the uninsured. Our federally qualified health centers could not keep up with the demand. They could not service everyone. So we got into that business at Lee Memorial because of Healthy Lead. We never would have done it if we hadn't heard from the community loud and clear we need to fill those gaps. So we are now a federally qualified look-alike program in 3 locations. It is a best practice. It has been recognized with several national awards because we didn't just do healthcare. We partnered with the United Way, who've been sitting at the steering committee from day one on Healthy Lead, and they are a great partner. We have United Way services in every office. We have the access to refer people or bring the services to them right in the primary care office. So that package is what people need. We're giving them not only access to health care, but access to the support system they need to be healthy. They go hand in hand. Another example, We Care. That program in Lee County had died. That is a physician volunteer medicine program where physicians provide their services to people in need. And every community in Florida can set up their own program. The one here had disappeared. It requires some bureaucracy. You have to have someone who files the paperwork with the state of Florida to give sovereign immunity. But more than that, you have to be able to support the patients who need the care so that they can properly prepare and respond to a physician appointment and services. It's not about primary care, the way the physician community defined it in Lee County. It's specialty care. So these are the high-end surgeries and medical treatments for cancers and other conditions that are a barrier to normal life, that create such a serious problem. We have over 400 physicians now signed up for this program. Last number I saw was like 435. More all the time. All the specialties are covered. And last year, more than $7 million in free care was provided to the residents of Lee County who would not otherwise have gotten that specialty care. It's profound.
Are there questions for the panel?
If the mayor of Grapefruit Springs called in and asked a question, what is the single most important thing that we as a local government in our community could do to promote better community health? What's the answer? Number one.
I would say be a role model as an elected official, as a visible leader in your community. If you can be a role model, what we have learned, and Robbie touched on this with the Horizon Council experience, the old adage, do as I say, not as I do, well, that's pretty powerful. If you want people to really hear you, be a role model. So it's an individual thing that you can do as a leader. Do you have healthy habits? Do you pursue healthy habits? Does your family pursue healthy habits? Do you support health and wellness as an employer in your community? Do you have a wellness program that works for your employees, and do you add to it and improve upon it each year? And then as you look at the role of government, as you define the programs of your city, where you are investing the resources of your taxpayers, how are those resources supporting healthy lifestyles? Do you have parks and recreations? Do you have sidewalks? Do you have bike paths? Are they connected? Are they safe? So there is a continuum, but it starts with leadership, and then it goes through all of your points of influence as a leader.
And if I might add, Sally hit it, it is the leadership, and it is that collaborative effort. And we have found there's so many good people in Lee County that all they need to do is to be asked and tell them what they can do. And once you lay it out, they're right there volunteering and they're making it happen. So it's that collective collaboration, but you gotta have somebody. And when Jim Nathan pulled this together, he didn't want Lee Memorial even known that they were behind the scenes on this. He wanted it being led by a community business person, because it is all about the community making it happen. Like Sally said, Lee Memorial wouldn't be doing some of the things if this group wasn't pulled together, kind of like the Horizon Council advisory to the commissioners. Well, here's Dr. Lee saying, this is what we need, here's the void, how are we going to handle it? And it's that collaboration of leadership that people get involved in.
What is the role of the Lee Memorial?
We have been the convener, so we provide support to the steering committee and the executive committee, and then our individual...
They provide you salary. Administration.
Our individual active members of the steering committee and the executive committee have volunteered to be champions for the various goals, so they provide leadership in those goal areas. And if they need further support, then through the executive committee, which convenes, we help facilitate that discussion of, are there more resources? Is there another way of looking? Are we ready to expand that program that we've had success in the pilot? So it's that continuity of the role of the convener behind the scenes to help lift everyone up.
My question is, what is the next big hurdle? And kind of related is, how do you see
2017, and everybody says, what now? Well, at our last steering committee meeting, we talked about that, and we said, we can't stop, because there's still so much to do. So we're gonna kind of run things concurrently, because you get Cliff Smith from United Way saying, we gotta just keep doing what we're doing. I mean, we cannot stop, because if we do, you know, Southwest Florida's growing, and you know the diverse population we have. We're just gonna go backwards if we stop, so this has to keep going. So, but at the same time, we said, but how are we ever gonna get ahead? How are we gonna get in front? So there's some bright, brilliant people who can analyze data. We need to be, and this is what we talked about, drilling down into our data and trying to get ahead of this. So kind of working concurrently, but Healthy League is going to continue. Will I be in this chair? Probably not. They need some fresh blood, some more young energy, trust me. And we have a lot of people now engaged, and so it will continue.
On food and nutrition, excuse me, food and nutrition, yes, it's a major part of healthy lifestyles. We have 5 components of the goals in healthy lifestyles, and one of those is nutrition. And there is a working group in our Healthy League Coalition, which is the grassroots group that meets on a quarterly basis to support all the healthy lifestyle initiatives. If any of you are interested in joining that, you can let me know today, or you can go to our website, healthyleague.com, and there is a contact us section where you can request to become a part of that coalition at any time. We urge you to do that. But I think one of the best examples of how nutrition has changed in one of our community partners is the Harry Chapin Food Bank. Because in 2007, when we started, they were doing 50,000 pounds of fresh produce every year. Last year it was over 7 million pounds. I found out yesterday, this year it's going to be over 8.2 million and growing. So they reinvented themselves. They developed partnerships with the growers. They helped to not only increase their own refrigeration, but they had to help get refrigeration for all of the food pantries throughout the service area. And that took several years with United Way grants and special funding from USDA. That was all a part of the Healthy League effort to make that happen. And now it's over 8 million pounds of fresh produce available every week to those who don't have access to fresh food because of their financial situation. So huge, huge impact. We at Lee Memorial have taken this need very seriously. We've had to reinvent ourselves. We had to reinvent our food for patients. We had to reinvent our food in our cafeterias. And once we got on that platform, we have been able to invest in the very best of research on nutrition. Our food service has developed a program for people who are witnessed and evident of malnutrition when they enter our hospitals. And oh, by the way, it's about a third of our patients. It's not a small number, it's about a third, and it's all ages. It's not just seniors, frail elderly, it's all ages. We didn't even know that. But as a result of studying nutrition and making sure that we are using what we know in the best possible way, we've now developed a program that is comprehensive at Cape Coral Hospital. It will be expanded to Gulf Coast Hospital soon. We hope to have it in all of our hospitals at some point. We send food home with our patients that have been diagnosed as malnourished, for a month after their discharge to help the healing process. And we hope that by that time we can help them, if they need to, get on Meals on Wheels, get a neighbor to help, family member to help, to provide food in the home. We get those systems set up to permanently provide nutritious food to that patient as they learn how to eat healthy food, as they get that practice of eating healthy food, not just what might be in the cupboard. So yes, it's very, very important. We've got so many initiatives in this area. You'll hear a lot more about it, and we want you all to be a part of it because it's quite an important plank in staying healthy.
We have time for one more question. I hope it's okay that I wrote that down. Yes, in yellow.
Hi. First of all, congratulations on your wellness scorecard. Yours is great. I just had a question about cancer-related deaths, and if you have any statistics you can share with us on those deaths.
We do, but I didn't pull it and I don't know it at the top of my head. I will tell you our cancer profile, if you look at our scorecard at the detailed level with the hundreds of data elements and you look at cancer treatment and mortality rates, we have a very visual way of showing this stuff on our website. And there's little sunshines. If it's looking good, if you look in cancer, it's all sunshines. Okay? Access to cancer care in this community, the treatment, the response, the mortality rate, all very favorable. But the American Cancer Society actually was advertising on TV this past winter. 80% of all cancers are preventable. So they turned it into a TV ad. So I think there's a lot of connections there that need to be made. And one thing that I wanted to mention as a follow-up to 211, Annette talked about how we've used it for children and it's applicable for families, and we're trying to engage everyone in these healthy habits. Healthy Lead will launch next week an opportunity to take the pledge, the 5210 pledge. It's up on the website now. If you want to pre-register, you can go on and take the pledge to adopt a healthy lifestyle personally by eating 5 fruits and vegetables daily and limiting your recreational screen time to 2 hours, right down the line. And we want this to be a way of engaging people in learning healthy behaviors. So in May, we're going to focus on the fruits and veggies, the 5. In June, we're going to move into the 2. Are you limiting your screen time? How can you leisure screen time? Yeah, we're not going to give you time off.
We know all day.
And so over 4 months, we'll reinforce this message with everyone who registers, driving you to the website. So you'll get some new recipes, so you'll be able to share through social media your experiences and help others by doing that to develop healthy habits. So we encourage you all to do it. We hope it'll be fun.
Thank you very much, Ronnie Repsdorf, Sally Johnson, and Annette Founders.
Charlotte. I'm like, hey, what's your resource book you guys use? Melissa's like, here, take it. So we can photocopy theirs. They emailed me like, the girl Jenny, remember Jenny?
Yeah.
She worked for Walgreens. She worked for Walgreens, but she gave me the list of phone numbers. She's like,